I've interviewed Dr. Gosia Gasperowicz from the University of Calgary several times about her modeling of the COVID-19 pandemic in Alberta, particularly the modeling that preceded the fourth wave, the disastrous fourth wave, where hundreds of people have died because the Alberta government relaxed its measures because it thought that the pandemic had moved to endemic status. Well, Dr. Gasperowicz is now talking about modeling a potential fifth wave. So I'm going to talk to her about that. Gosia, welcome to the interview.
Hello, thank you very much for inviting me.
Now, you accurately modeled the fourth wave, despite Alberta Health's botching the job. Now you're modeling a fifth wave. Can you tell us about that?
Yes, so it's basically a very hypothetical model, observing what is happening in Europe. So seeing that many countries that have higher vaccination rate than we have, but loosen the restrictions, have now a huge surge, like doubling time for 13 days, 12 to 13 days, which is extremely fast growth. So basically, we see in Alberta now kind of plateauing. So basically, if we loosen the restriction, we can expect similar outcome as in Europe. So if we go into if we would just have, after loosening the restrictions, the early increase observed in Denmark, so doubling every 22 days, then we can expect 2,000 daily new cases in late February.
And if I understand this correctly, the odds are pretty good that there would be the hospitalization rate and the ICU rate would still be coupled to the infection rate. So as the infection rate goes up, then your hospitals fill up and then your ICUs fill up.
Yes.
Have I got that correct?
Absolutely. So everything boils down to the transmission. If you have transmission, you have infections. If you have infections, you have severe outcomes. You have hospitalizations, you have deaths, and you have postponed surgeries as well, right? So nothing decoupled, unfortunately. Like seeing in Europe, when you look at our world in data graphs, you can play with logarithmic versus linear scale there and compare hospitalizations per capita and cases per capita. So in every country where cases go up, hospitalizations go up, even in Portugal. And it's important because Portugal, 88% of total population, not eligible, but total population, 88% is double vaccinated. Yet their cases are increasing and their hospitalizations are increasing, and the trajectory of increase in hospitalization is similar as in Denmark. So there's no decoupling.
Now, when the last time I interviewed you, we were talking about the mistakes that the Alberta Health had made in their modeling, which they had worked with assumptions that came out of the UK. And then they realized in late July, I guess it was, that the assumptions they should have been using was really the southern United States that was more comparable to Alberta. So is that observation still hold true, that the European data and assumptions do they now translate to Alberta? Are they applicable to Alberta?
I don't know how much UK assumptions are applicable to Alberta, but continental Europe, I guess they are. Like whenever you have population with high vaccination rate and you see that there is no decoupling, and it's not in just one country, but it's in many countries, that's what you should go with, right? Yeah.
And consistently in those continental European countries, you're saying that all of them relaxed their measures, and that is what preceded the increase in infection rate.
Yes, in most cases, yes. So in Belgium, they dropped mask mandate, and just 10 days later, the increase started. Similar thing in Denmark, also like around 15 days after relaxing measures, maybe a little bit more, but like 2 weeks, not more. They observed the increase. So they declared, they basically dropped mask mandate and all the internal measures, and then they had the increase. even in Portugal. But in Portugal, they fortunately didn't drop mask mandate. So the increase, they had increase in cases, but it was slower. But it continues, and now actually jumped into higher rate of increase,
So
although they are 88% vaccinated.
Right. So Portugal has a high rate of total of vaccination. They kept the mask mandate. So when the infection rate began to go up, it went up slower than the other European countries?
Yes, it went up slower.
I wonder why it went up at all. Were there other prevention measures that they relaxed, even though they kept the mask mandate?
So yeah, I know that they relaxed some others, but I don't know exactly what kind of measures that they were. I just know that they relaxed almost everything except of mask mandate. And for me, like, interesting is Austria, because they had quite a lot of good measures. Like, they had mask mandate, and especially the high quality respirators, so N95 grade and higher, for example, in grocery stores. Also, they have rapid tests and PCR tests for people. For example, to go to nightclubs, people have to be tested with rapid test at least. Quite high, like 64% total population vaccinated, and yet October 14th they jumped onto a higher like fast growth from basically a flat rate, like plateau. It was just instantaneous flip. So I don't know what caused it, if it was few super spreading events. That's why I totally don't feel safe when we are on this plateau thing. When we are not in a, so I think the only safe place is if we have stopped all community transmission. So if we have 0 community cases, then we can be sure that, okay, we are safe. And when cases are going down quite sharply, but now they are not going down sharply. So we are in this moment that it can basically flip up any moment. We can't even know when. For sure, if we reopen and loosen measures, that's almost a guarantee that it will go up.
Well, Gosia, we're staring down the barrel of a 5th wave. What can we do to prevent that happening? So
first of all, we shouldn't relax measures that we have already. The second most important is seriously treating SARS-CoV-2 as an airborne virus and an airborne pathogen, and using airborne precautions. So ventilating spaces, using CO2 meters to know whether ventilation is good or not. And if we don't have CO2 meters, then having assumptions that the ventilation is bad. And then using air filtration, so portable HEPA filters, using masks, high quality respirators, so N95 and higher. There is a lot of available ones in Canada, made by Canadians, the soft shell ones, sort of. So this, addressing spread in schools, because we have high spread in schools. So again, airborne precautions at schools, and yeah, preventing spread in children. Then vaccinations, so both 3rd doses, so giving people 3rd doses, all eligible people 3rd doses as fast as possible, because the immunity wanes over time. And as soon as vaccines are available for 5 to 11 years old children, vaccinating them as fast as possible. And then using rapid tests especially in schools, but also in other workplaces. And before going, for example, before dining, before gathering, before any big gatherings like theater performances and so on.
Great. Gosia, always appreciate your insights. Thank you very much for this.
Thank you very much.